Hi guys, here's how to assess a PICC line or a peripherally inserted central catheter. So we're just gonna assume this was a PICC. Usually most times PICCs are up here on their arm in a patient. So we're just gonna pretend this one's a PICC. So when you're assessing it, first you wanna look to see what size it is, how many lumens there are. So there can be 1, 2, 3. So just kind of make note of that. And then just look at the dressing, ensure that it's been changed within at least a week. That's the minimum. It has to be changed weekly or as needed. On our mannequins, we have these blue patches on the arms, and they're called biofilm, and they kind of just prevent infection, because central lines obviously pose a great infection risk, because instead of it just being like a peripheral line where it's very short, this one goes all the way and the tip is in the superior vena cava of the heart. So if you come over here and look at this line, I'm looking at the date that the dressing was last changed. I'm looking up the line, seeing if there's any infiltration, phlebitis, irritation, making sure that the line is in. Another thing is you're going to check for patency. So I'm going to wash my hands, put my gloves on. And with PICC lines, whenever you're injecting anything into it, so when you assess for patency, you just use a flush. So you always use a 10 milliliter syringe, no matter what. So what I'm gonna do is I'm gonna take my alcohol swab, clean the lumen for 15 seconds, and then flush with the 10 milliliters. So with PICC lines, instead of just jamming it all in, first you want to pull back for blood return to see if you're getting blood return. So that's a sign that it's patent and it's in the correct spot. And then when you're pushing, you're not going to slam all of it in at once. You're going to use the push-pause method, which just kind of breaks up any like blood or anything that could be stuck in the line. You want to assess that the line's not sluggish. It should pretty much be very easy to push things through. So I'm pushing, pausing, pushing, pausing, pushing, pausing. And you're going to keep doing that until the whole 10 mL is done. So this line would be patent. If you're like struggling to push it in, that's a sign that it's not patent. You want to do this to all the lumens. If there's 2 or 3, make sure you test that all of them are patent, because in an emergency, you might just pick one. And other than that, that's how you assess a PICC line.